One would hope that when your life is on the line, that this kind of partisanship kind of drops out, right? If we're both being affected by this notion that someone comes up and is going to kill you, shouldn't matter if you're Republican or Democrat, your reaction should be quite similar. The way we think about partisanship affecting kind of individuals' responses to these kind of public health events kind of stem from, one, anecdotally, if you kind of look around and just like from reading the newspaper, thinking about how people have been debating, we kind of see these partisan divides, right? This very black and white view on certain topics. However, a lot of these like public policy debates with respect to health are very kind of uncertain, right? So even though COVID is coming, there's uncertainty as like, am I going to be affected? Is it affecting larger cities more than in rural areas? So it's the perception really matters in terms of how you behave. And it's even more important in kind of these epidemics because of the externalities that our behavior has, right? So I could be very conservative because I perceive COVID as really bad and I could get it, right? I could be very conservative, yet if my neighbor doesn't really care, it doesn't matter how much I stay in my apartment if he kind of knocks on the door, right? And he's been walking around the whole Chicago and the Riverside thinking, oh, it's great, I can walk around, there's nobody outdoors, right? So the externality from our behaviors means that we really need compliance for a lot of these things. And that also now leads to how do we perceive kind of the laws being passed, the guidance being given by both the CDC, those in political power, and kind of our idea was like, to what extent would we observe differences in the behavior of these individuals? Given that the political party in power at this point is kind of the Republican president, right? And you have a Democratic House. We want to kind of explore how two individuals that are exposed to the same kind of risk, right? Because what we don't want to be capturing is just that if you're Republican and live in a rural area, you're just less likely to be affected by COVID because there's no density, less likely of individuals to come from abroad. So in that sense, it wouldn't be that crazy to believe that they move around more than people in cities where there's high density, there's more interaction from abroad. So we want to kind of control for all of that and kind of generate this experiment where we're saying two individuals that have the same kind of likelihood to be exposed are now behaving differently because one perceives it as of a lower risk because those in my political party view it as not that big of a deal, right? The competing argument that a lot of people would make is just saying, Republicans might have different preferences or risk preferences than Democrats, right? They might be more risky, right? And as a result, you would say, oh, Republicans aren't going to follow the rules as much as Democrats because they're willing to take on more risk. So we tried to kind of look at these two kind of arguments, and what we end up finding is that, yes, after you try to control for all these other characteristics, the economic characteristics in the area, the actual risk of contracting COVID, we still observe a difference between high kind of Trump areas versus low Trump areas. Now, then you would say, well, is this just kind of risk preferences? Well, no, because if we look at the time series over the pandemic as kind of Republican news media, kind of like Fox News, as the president starts taking this more seriously, we actually see that the behavior of these high Trump areas, these high Republican areas, they become more conservative now, right? So they're doing more social distancing. So that would kind of go against the view that it's just a preference argument, right? It's more that the perception seems to be changing as those in power, kind of those of your political party, start taking it more seriously, right? So we use this event that we can say, hey, there was CPAC. And then CPAC is a Conservative Political Action Committee gathering. At that event, certain high-level Republican senators like Cruz from Texas got exposed to someone with COVID. This was reported the following week, right? So it's when that information came out and you heard that, Cruz started doing self-quarantine. Then we start seeing that in these Republican areas, we start getting a little bit more of social distancing. So they're kind of catching up, right? So Democrat areas in the same time period are still becoming more conservative, right? They're social distancing more. It's just that Republican areas are now doing it at a higher rate because they're catching up, because they're taking it seriously. And in that sense, it's kind of not surprising, but it's kind of worrying when we kind of think about policy responses that partisanship affects the compliance, right? And And given that we're kind of in these free societies, we don't have like the National Guard or the military coming out and standing on the streets, making sure we don't leave the apartments. We rely on kind of compliance by the kind of the electorate. So the notion of kind of how bipartisan reactions would seem to kind of facilitate more of this compliance, right? So you, rather than having the two parties opposed, right, you would think that bipartisanship would allow for more compliance because now everybody's kind of thinking is on the same page. We're not saying that, you know, the Democrats were right or Republicans were right. We're just saying that it's very interesting that despite being kind of exposed to the same risk, we still see different perspectives, right? It could be that Democrats overreacted to the risk, right? Or it could be that Republicans underreacted. We don't want to really take a stand on that, because in order to take a stand on that, you have to be really specific on assumption. So we're not taking any normative stance on who was right or wrong. Our main point is, like, if you want to think about policy and compliance in this voluntary, you know, free society that we're in, it matters the information and how we perceive that information. And the fact that we have either, you know, news sources or political leaders from the parties that have these kind of diametrically opposed views on subjects for whatever reason seems to affect the behavior of individuals that have real consequences, in this case, kind of in human lives, right? Because we end up observing certain mortality rates.